my name is Lynsey Woodman. I'm a specialist occupational therapist and I'm also the clinical lead for the ME CFS service in Lincolnshire. And we are now doing, we're commissioned to do some of the long COVID work as well. Well, the service we're offering is very much in line with the service that we offer for the patients we see through the ME service, because many people with that diagnosis have often had viral illnesses, and as services up and down the country, we're very well adapted, and our rehab model works very well with post-viral fatigue. So we developed a very robust programme over many years of working with patients, what they wanted, what helped, what worked, etc. And so we've adapted it to the long COVID, or a portion of the long COVID community who meet our diagnostic criteria. And we're offering just a very robust programme to help guide them through the steps they need to take to start getting their health and well-being back. And for many, that is very, very successful, which is wonderful. It just takes time, and it takes a very specific approach sometimes. Well, it's usually we assess it at a multidisciplinary meeting. So as a bigger service, we meet with the Lincolnshire Community Healthcare Trust that hosts the post-COVID service, and we all meet and triage referrals, and it's a process. So often many people start on the app because they can get on the Living With app very quickly, and that offers them some very robust information to get them going. Often it's a clear case that somebody might need a bit more respiratory input. But if the predominant symptom is fatigue, and often some breathlessness is what we're seeing as well, and if there are no other specific comorbidities, then we'll look at it very carefully. If it is really about assessing need and whether there is any significant and obvious reasons that might be driving the fatigue other than having had COVID. And then obviously we then do a very robust assessment to sort of unpick and try and put the picture together of what can be dysregulating the body's systems to create the fatigue cycles that people can get into. So it's probably, I would say, maybe a third of the referrals that are going into the post-COVID service that might be appropriate for us. So if people have pre-existing diagnoses of cardiac problems or potentially respiratory problems, COPD, etc., then they're better managed through the main post-COVID service, who have good resources and occupational therapists and people they can access to help them specifically with the rehabilitation around recovering from COVID alongside their pre-existing conditions as well. Living With app is very much, if they just contact the service, I think there is actually probably going to be a link on the website, but I could be wrong. We need to check that with the main service, where people don't actually necessarily have to be referred to the service to get access to the app now. The app is full of lots of fantastic information around breathing, around managing fatigue, around sleep, around all the aspects people have been struggling with post-COVID. Lots of good, robust advice by qualified therapists, and that's very accessible for people now. They can get onto it and start working through it. So that is very accessible, I think, just by, I'm sure there's going to be a link that they can access without actually having to be referred into the service, but don't quote me on that. Check that before that goes live, but I'm pretty sure that's just come out as a new routine to start getting people help straight away. I think it's changed since the beginning of the pandemic. We noticed a lot more symptoms at the beginning of the pandemic, probably a lot more loss of sense of smell and taste and a whole multitude of symptoms really, which is not dissimilar to what we have seen as a chronic fatigue service have seen through many of the spikes in SARS or MERS or swine flu. We've had viruses before, not in this at this level as a pandemic, where we've seen a spike in people coming into our service. So it isn't uncommon for some people's bodies to struggle after a virus. And so the body responds in lots of different ways. And we use a model of dysregulation in the body systems and explain that to people and why the rehab is so vital. So back to your question now, the symptoms we're tending to see predominantly are around fatigue and breathlessness. They're the ones, since the virus has changed, they seem to be the main symptoms that people are reporting to be the most disabling. So some myalgia, some pain, some fatigue, and the breathlessness as well. And maybe, some palpitations or, some dysregulation. And obviously, as a service, as a wider MDT service, we have GPs on our service that will be looking at the referrals as well. And if there's any worry that something might have been missed, we're very good to triage that back to the GP or to an appropriate service to make sure people are really medically stable before they are put on a rehabilitation programme. So the service is very cautious about catching things that might have been missed to make sure people feel reassured that this is the way forward. Fatigue is a huge subject, and obviously I'd be out of a job if fatigue wasn't a very, very key problem for lots of people. And I think there's lots of misunderstanding about fatigue. I try and explain it to people that fatigue is very different from tiredness. So what a person might do when they're feeling just a bit overwhelmed, they've done too much, just take their foot off the accelerator, ease off, have a good night's kip, and their body usually picks back up again. When fatigue starts to increase, different mechanisms are at play in the body, and it is very poorly understood. So with fatigue, multifactorial things can affect and drive fatigue cycles. And I think for me, I just find the area, you'd think, having worked for 19 years in this area, I'd be quite chronically fatigued at the whole issue of fatigue, but I feel very energized about it because I think our understanding of it is getting better and better. We're understanding the body's energy systems. We're looking at it as a very holistic biopsychosocial model. We're really starting to look at the human that is experiencing the problem, rather than just an isolated area, because energy runs through us in every single cell of our body. And so often it's about going upstream and looking at why has the body started to struggle to renew its energy, to sustain its energy. And researchers are doing their best to do the explorations to find out mechanisms, but I think it's so multifactorial. There are likely subgroups within a fatigue group that have different reasons that drive their fatigue. So we might use the term MECFS, or we might use the term long COVID, but most people with those labels will have different physiological things happening for them. And so I think it's taking a very personalised approach, really good, robust assessment, really hearing the story. And obviously with our expertise, the expertise of the therapists in the Post COVID Service, we start to sort of see the patterns or the factors that could be contributing or driving the fatigue cycle. So our rehab is based around, basically, I'm an optimistic OT. I always believe the body is an innate healing system when it's got the right ingredients. So I know we all want to have a magic pill in this day and age to make it all go away. Hopefully research will come up with that wonderful pill that will make it all go away. But I think realistically, we're a long way off. And so I think for most people, if they can be guided and we can set things up for them to enable them to help their bodies to restabilize, so they can start to build up their systems and allow their systems to do what they need to do, then hopefully for most things start to improve. But the difficulty is often in the plates people are spinning, trying to get better as well, trying to hold down a job, trying to look after family members, some are carers, and it's really tricky for them. So I think, offering as much understanding, support and guidance and encouraging people, giving them hope that it will improve, but and sometimes you don't need the world to stop. You don't need to stop work in order to help your body get better if you can start to work with it and help it to move itself forward. So energy is a vast subject and we could talk all day about it, but key things I would suggest to people is they often read fatigue as being a very physical thing. But fatigue isn't. Fatigue is driven by so many factors. It's driven by, obviously, the physiology in our body. It's driven by how we're feeling, our emotions. It's driven by the mental stress we're under. It's driven by the environment we're in. We are essentially, as human beings, we're a bit like plants. We're cells, but we just have more complex emotions. And so if you plant a plant in the wrong area of the garden and you're not giving it the right ingredients, it doesn't thrive, it doesn't grow, it's not able to use its systems the way it's designed. And as humans, we need to look at ourselves similarly, in that we are a complex structure of cells, and if we can get all the ingredients right that our body needs, over time it wants to survive, it will start to find a way to balance itself, hopefully.
Love that analogy.
That's a good question. I think for people that we see, I'm sure obviously the main post-COVID service have got lots of successes to talk about as well. I can only talk about it from our perspective. I'm a big believer that knowledge is power. And I think the way our system is set up, no fault of GPs doing an amazing job, primary care workers doing an amazing job, but the system is not set up to give people the time or understanding to maybe validate, hear what's going on for them. And I think because people genuinely start to feel so unwell, they're seeing people around them going, well, they got better, why didn't I? What's wrong with me? I genuinely do not feel well. They go to their GP, have the multitude of blood tests done, etc., and it's, your bloods are fine, everything's okay, but it doesn't add up. As a human, we want to know, well, what is it then? Because I genuinely feel dreadful. And so people are left thinking, well, am I going mad? What's the matter with me? So they might push on and try and push through it, which obviously will drive them further into the problem. But inside, that emotional stress will start to build. So understandably, people are getting more anxious because they don't understand what's wrong with them. So we might see more anxiety, but is it the cause or the effect? Might be a bit of both, but often it's because people just don't get what on earth's happening with them. And then the fear is people go down the rabbit holes on the internet and start looking at Dr. Google, and it's not very helpful. And so we like to just pull people in when they come to our service and explain it in a way that validates it, that makes sense. We explain it very physiologically based on what we know to date. Can all change tomorrow, we don't know, but based on the research we have to date, we have a very plausible explanation for what can happen to a body post-virus and what starts to dysregulate its systems, leading to the multitude of symptoms that people go on to experience. And it's almost like you can visibly see people do a big out-breath. And then, oh, okay, that makes sense, but okay, what do I do? Right, well, just hold the line, take some steps and follow this guidance, frustrating as it may be, because people just say, well, I just want my life back. I've got to crack on. I've got things to do. I can't afford not to. And it's working very, carefully with each individual about what's important to them, what what they're being stopped from being able to do due to their symptoms, and also supporting them in the workplace. So I think as occupational therapists, we have a key role in speaking to employers about giving people reasonable adjustments, helping employers understand what they need to do to retain the skills of their employee, to enable them to get back to work, playing the long game, because with post-viral illnesses, people can rarely get back in a month. And that's usually the old adage, we've all had it. You have flu, you crack on after 2 weeks, you're probably dragging yourself through the next 4 weeks as you're picking up, because we don't give ourselves permission to slow down, to just take our foot off the accelerator and go with what our body actually needs. So if anything, this has enabled us, and it's enabled us to put forward stronger to employers. Look, people can get better. Give them a chance. Give them the adaptations. Give them the right balance. People's stress go down immediately if they feel their employers are backing them, they're investing in them, and slowly, slowly people can start to build themselves back. So for everybody, we've seen a lot of success. I would say I'm incredibly hopeful about most people who have long COVID. I hear it up and down the country with the networks of allied healthcare professionals working with long COVID, is the majority are getting better, but it just takes time. And the reasons why some might be still struggling significantly, well, we have to hold our hope in the research that's going on, and lots of it is, but research is never a quick thing. And it's always very frustratingly complicated. But on the ground, as healthcare professionals, we can make a huge difference, often in giving people permission to slow down because they understand why. Not to the point where they're stopping, but to the point where they're just finding a balance, learning to work with their bodies a bit better. I think we live in a world that's very dominated by head and got to keep going, got to, devices, etc. And we've lost the connection with actually what our body actually needs. We're scared of our body rather than actually listening to it and working with it. When we understand all the little ingredients, and the body goes, oh, amazing, thank you. Okay, I'll reward that with a little bit of better energy, etc. But it's hard for people to get their head around because, in fairness, many people are spinning lots of plates at the same time. So it is tricky.
Thank you. So what would you say, just trying to link this in with the work that Active Lincolnshire might be doing around activity and the support for people. So, is there anything you would say around, activity leaders and support for people, and just acknowledging, how to support them to get back into activity at their pace? I don't know whether I'll let you say it.
Yeah, that is a very important question. And I would say that we need to be cautious with activity for a number of people with long COVID, post-COVID syndrome, because exercise, of course, is so important for the human body. I like to talk about restorative movement. So I think graded exercise as a term has been very poorly understood by people outside of specialist services. And as such, if you hear that term, your tendency is to think, right, well, I've just got to exercise my way out of this. I've got to get fitter. And actually, if your body's already dysregulated, you're just going to throw it into more chaos. And so people start to find they try and do stuff. So most people on a better day can do a lot more. And it's the idea of don't try and get into, it's more about thinking to yourself, okay, over 7 days, I need to try and do a similar amount, a bit of movement, because we all have tasks to do. We've got to run our lives, our homes, whatever it may be. And it's about, I call it the foundations of a house. So you put the foundations in first before you start building the bricks, which is the exercise, getting your heart rate up, etc. So when people can say to me, I can happily go for a 30-minute walk most days, nice pace, I can manage my life quite well, I'm getting to work, I'm not crashing at the weekends, and etc., etc. I want to get a bit fitter, that's when we'll start to look at a graded exercise program. And that's very specialist to the way we would do it is very gently and start to build the heart rate up in a different way. So activity coordinators, I'd encourage them to, I think less is more, build core strength, it's all about getting a stable baseline over a longer period rather than doing more on one particular day and then suffering for it. So if there's any sign of what I would call post-exertional malaise or post-exertional fatigue, which is unlike, most people can sense it in their body. We know when we've overworked a muscle, it's like, oh, and we can feel it, but it recovers. If it's like going on for days and you can really feel like a bit fluey, a bit ill, a bit malaisey, you're doing too much. You've got to ease back and get a stable baseline. And what we teach in our service is the physiology around why that is, because everyone's heard the term pacing and very few people actually understand what it means, because it just seems, I've just got to do not very much. But actually pacing is we call it stabilizing. And it's managing all the things in our life, not just the physical, because we're not just a physical body. If something happens in your day and you get stressed, your energy system can flatten just because of that. I think co-production is a fabulous bunch of healthcare professionals and people with lived experience. They're experts, they know, and many of them have worked so hard to put their health back on track again, and they should be celebrated because it's not easy, but they are real, just inspirational people to turn their lives around and be able to put something back into the system to offer hope, offer people guidance. And I just think this is offered. There's always good comes out of bad. And in the pandemic, look at all the organisations that have joined together. I've met I've met, so many different colleagues in the local authority. We've all worked together to pull together this co-production, this phenomenal website that would be a wonderful resource for people. As trusts in Lincolnshire, we're working across trusts very fluently. It's wonderful. It's the way it should be. So it's a great group, very optimistic, very positive, very can-do attitude. So it's been a pleasure. I think hope is, for any human being, is knowing there's a way through it. Because when we grow up believing our doctor's got the answer for everything. And I think, in fairness, doctors feel very frustrated with these types of conditions because the way their services are set up is diagnostically, it's medication based. And so they don't know what to say in 10 minutes, just as besides our assessments can take up to an hour and a half at times. So we have the luxury of time to really hear the story. So we can really then start to see with our expertise the things that are causing the issues and put them across in a way that really enables a person. I just believe humans are their own best expert. A doctor isn't an expert on someone, neither am I, but I know a set of skills. I have a set of information, as a GP might have, a consultant, that could help that person to get a bit further along their health journey. So I think the minute you put that person back in control of their life, they've got the tools, they've got the skills. Most people just want to get on with it. Nobody wants to be ill. Nobody wants to keep themselves unwell and stuck. They just don't have the right information to help unstick them a little bit more, to start rebalancing their lives. So hope to me means upskilling someone to start to get back in control of their life, and then reassuring them the process, it does take time, but it will be okay. My top tips are to be kind to yourself initially, very difficult sometimes, because in times like this, particularly when we don't understand, we can start to become our own worst critic and Just think, if your best friend wouldn't like you to speak to them the way you speak to yourself, maybe tune that language down into kindness. The body responds to kindness. I would say stabilizing is so important. Get out of that boom and bust as best you can. Learn about what restorative rest means, which isn't just sit and put your feet up on the sofa or scroll your phone. It's about really deeply resting the body and learning how to work within a baseline that your body can consistently cope with, and then just build gradually from there. Sleep is huge. Really, there's not enough emphasis on helping people get better quality sleep. So some people might sleep, but they don't maybe sleep well. So they still wake up exhausted. And so it's really understanding sleep and working on a good, robust strategy for managing sleep, getting into good breathing patterns. We're seeing a lot of dysfunctional breathing and just poor posture, and I guess just it doesn't help the body's systems to make the energy it does. When you go upstream and look at biologically how the body makes energy, we need to breathe, we need to move, we need to open our diaphragm, we need to help the body's systems do what they need to do. And so it's doing it at the right level. And so multitude of strategies, but my top 3 steps would be sleep, getting in some good breath work, which is there on the app. There is some advice on sleep, but there's tons on the internet. There's free resources. YouTube's got tons. I had just Google good tips for managing my sleep or getting into better sleep. Stabilizing your activity. Think of that house and getting your foundations solid before you start building all the fancy bits on top. Work, going out, spinning all the plates, and be gentle with yourself. Give yourself permission. It's the invisible illness. You can't see it. You look okay. And so you think everyone's looking at me thinking, well, I must be a real fraud. Validate yourself. Know yourself. So if you know, look, I don't want this. I'd be out there like anybody else doing everything I want to do if I didn't feel like this. So listen to yourself. Be gentle with yourself and give yourself permission to go at the pace that feels right for you as best you can, and give it time.